Hello, and welcome to another episode of Physioactive's Singapore Surgeon Insight series, where we bring you conversations with leading medical specialists to help you better understand your condition, your treatment options, and your recovery journey. I'm Michelle, and today we're pleased to be joined by Dr. Chua Soo Yong, orthopedic spine surgeon of Atlas Clinic, Singapore. Today, we'll be discussing a condition that is often misunderstood but very important to recognize early: cervical myelopathy. Doctor, thank you for joining us. To begin, could you briefly share your background and your experience in treating spinal conditions?
I treat all kinds of spinal conditions, and including cervical, thoracic, and lumbar spine. Cervical myelopathy is something I treat very often because patients usually come in to see me with poor balance, some vague symptoms of numbness, and when we do a scan, we find out what the issue is. So then we explain to them what they are facing.
Okay, so in simple terms, could you explain what it is and how it differs from more common neck problems?
Basically, first of all, to start off with, what is cervical myelopathy? So that is a patient's neck model. You can see it's as if it's me sitting like this. The back of the head is here, right? Okay, so from the front of the neck, that's where the throat is. These are all the neck bones. Behind the bone, you will see this yellow structure is the spinal cord. The spinal cord actually goes down this spinal canal. Okay, each side there's a nerve going out on the left and the right. The spinal cord is actually this yellow structure behind here. This yellow structure behind here. The yellow structure behind here is the spinal cord, and if anything damages the spinal cord, that is what we call cervical myelopathy, which means the cervical spine, the spinal cord is sick and damaged. So that is how we define cervical myelopathy. Commonly, neck issues, they present with pain, usually in what we call the axial spine in the neck itself, or they can present with radicular pain, which is pain going down the arms or the shoulders or the various parts of the body. But cervical myelopathy, ironically, is asymptomatic a lot of times in terms of pain. Patients have very vague symptoms of numbness. Sometimes they have some complaints of dropping objects, clumsiness in the arms, and the hands. I don't feel so dexterous anymore when they use a pen to write or they use the chopsticks to carry to pick up food and stuff like that. They drop the objects. In late stages, they can complain of poor balance when they walk. They feel uncomfortable, they feel clumsy, and they sometimes present with frequent falls. So pain is not a dominant symptom of cervical myelopathy. Unfortunately, cervical myelopathy often is discovered late than early. So it's not really, a special form of pain that they feel or some discomfort that they feel that brings them to see the doctor. Very rarely, sometimes patients can also be involved in a car accident, and then they, end up having some issue with, walking, balance, and dexterity, and then that sometimes actually triggers the underlying myelopathy to worsen.
Okay, and how is this considered more serious than just neck pain or a pinched nerve?
Yeah, so if you line up spinal conditions in terms of severity, the most important structure in the whole spine that we're dealing with is the spinal cord. And the spinal cord is damaged, there's nothing else to talk about, So cervical myelopathy, if you define it, means, the word cervical is the neck. Myelopathy means, you break down the word myelo and pathy. Myelo means spinal cord, and pathy means sick. So myelopathy means the spinal cord is sick. Therefore, if you have cervical myelopathy, the spinal cord is sick, basically implying the spinal cord is damaged. And therefore, it is the most important thing that we treat as spine surgeons in terms of, degenerative conditions, issues that may affect function of the patient. Besides pain, which is something we treat often too, but pain usually is due to a nerve issue, which usually responds well to various treatments like physio, medicine, and, maybe even injection to the nerve. But a lot of times, cervical myelopathy is not treatable without any form of formal surgery. Unfortunately, that is when patients sometimes get that kind of fear and they try and postpone the treatment, or they just stuff it under the carpet, and that's when things get worse because we are dealing with a window. The window shifts every time you wait, because over months and weeks, your spinal cord can get further damaged, as the window shifts. Example, if I were to be, if I were to strangle somebody, right? If you strangle somebody, the first few seconds, they're like struggling with you, fighting a lot, right? About 2 minutes, they may become blue. 6 minutes, they are brain dead. So if you squeeze the cord for a prolonged period of time, of course, it will die. And when your cord has an issue, it starts to perish. The cells in the spinal cord actually perish, and then they will never come back again. And therefore, it's important to chase that window to make sure the patient doesn't worsen.
Okay. So without going too much into the technical details, can you briefly explain what the surgical treatment aims to achieve, and what the recovery time, pre-op, post-op, rehabilitation if need be? Can you give us a bit of details on those?
Yeah, so the treatment for cervical myelopathy is nothing other than surgery, unfortunately. It's one of those rare conditions that I actually tell my patient, hey, you need to get it fixed. For patients with nerve compression, some kind of back pain, neck pain, usually I offer them conservative treatment first, because that's the most common thing that can help the patient improve. However, cervical myelopathy is on the other spectrum where nothing can help besides surgery. And therefore, the treatment of the surgery depends on a few issues: age of patient, type of pathology, and whether it's multi-level or single level. The approach can be either, in principle, coming from the front, where you fix the disc from the front or remove whatever is compressing the spinal cord, or from the back. To treat cervical myelopathy, there are various options for, like I said, surgery. From the front, you can fix the patient's neck from the front using a implant like this, where you remove the disc and you put an implant in there with the screws, and there's a little cage there to free up the spinal cord inside this channel here. Okay, that's from the front. Now, from the back, you can see that's the front of the neck again. If you turn the patient to the side and you see the back, we can also free up the spine from the back by removing all these structures where there's like a roof. We remove the roof and we put screws to stabilize the neck. So these are various options we can offer to fix the patient's problem of the cervical myelopathy. Of course, there are other approaches and options, but I'm just showing some examples of which. Usually, a younger patient with single or two level pathology, we would usually approach from the front. But if there are multiple levels that are involved, usually more serious, condition of like multi-level involvement of the cervical spine that's affected, or the patient is usually older, I think most people would prefer to operate from the back if suitable. Depends also on a lot of other technical considerations, but each case is, specific to each pathology.
And how long is downtime, and how long do they need to stay in the hospital post-surgery?
Well, for a simple surgery that involves one or two level anterior from the front, the patient usually either comes as a patient in the same day we operate, and the next day they can go back. Or if it's a patient that has multi-level involvement, they may stay longer, or even the surgery from the back, they can stay maybe a couple of days and they can go back. So it's not like a very prolonged period of stay. Yeah.
Okay, so for those who Indonesian patients that want to come to Singapore for this, what should their itinerary look like?
I guess it's important to establish the problem first to ensure that what is being treated has to be appropriate for the condition. And once that's established, we will need to examine the patient to make sure that whatever we're dealing with is exactly the problem, and then offer the patient a treatment sort of like program. And most patients who stay here would usually, after doing the surgery, stay for a couple of days. Let me examine them after the surgery to make sure the wound is all okay. Teach them dressing changes for the wound, and then, follow up 2 weeks later, the stitches usually are absorbable, but they can remove the stitching ends at the end of 2 weeks. For patients who have a bigger operation, like from the back of the neck, or their multi-level involvement, they can stay up to a week or two in Singapore just to be safe. I think that's a pretty reasonable window. But if you are staying nearby in Jakarta, usually like an hour or two, it's not a big deal, except the traffic I know is quite terrible there. Yeah.
That's right. And recovery is always a major concern for patients. So, how important is a rehabilitation before and after the surgery for the case of
Oh, a
cervical
very good
myelopathy?
question because basically pre-operative physiotherapy and conditioning to improve the pre-morbid condition of the patient is extremely important because if you start strong and do the surgery, usually surgery is an insult to the body, So you start strong and you have a good, pre-operative, pre-morbid, condition. You dip a little bit, you can recover quite fast, But if you're really starting from poor, there's a huge hill to climb, and we have to help patients kind of get over it.
Yeah.
So that's the pre-operative physio. But post-op physio is extremely important to help them get back their functional status, strength training and all that kind of stuff. And sometimes dexterity also needs to be retrained if they previously had some form of spinal cord injury pre-existing. A lot of them would have a spinal cord compromise prior to surgery already because many of the times, like I said, many patients present late.
Okay, and do you have any other advice or any cases to share with with our viewers, doctor?
It's actually very important to diagnose patients with cervical myelopathy early because patients who suffer from this condition, it's like a downward spiral. Once you hit the slippery slope, the patient's condition gets worse and worse. I remember I had a patient who came in a wheelchair. He couldn't even sign his name. He's a businessman, And he was so weak, he couldn't even sign his name. I had to use a thumbprint to get his consent for the surgery. So the surgery involved multi-levels of the cervical spine to be released. And after the surgery, he could actually walk into the clinic with a stick initially, but after a couple of months, he progressed to walking almost normally. However, most patients who are discovered late never recover full function, but their function right now is a lot better than before. I do not tell my patients, empty promises where, hey, you'll be able to fly, you'll be able to do all kinds of stuff that you never imagine you can, but we have to be realistic. When the spinal cord is already damaged, we want to regain function for the patient. That's the most important thing,
Yeah.
From a patient who couldn't even walk and use a pen to sign his name, you can actually walk almost normally and perform his daily, what we call ADL, like activities or daily living. I think that's the most important thing that we need to achieve for the patient.
All right. Well, doctor, thank you for sharing your insights and helping us understand this condition better. If you'd like to learn more about Dr. Chua, you can find the details in the description below. And if you're preparing for surgery or recovering from a spinal condition, the team at Physioactive is here to support you every step of the way. Thank you for watching, and we look forward to bringing you more expert conversations in our Singapore Surgeon Insights series. Thank you, Doctor.
Thank you. See you around. Bye-bye. Take care.